She is just, she is a, she is an amazing health and women's advocate for exercise, nutrition, just like Robin and I, all the things, to help us to age better, to age in a better space. And she is like me. I feel like we're very curious about women's health and curious how we're aging and just being curious about like what we can do to improve, things. And so I want Lori to introduce herself and tell a little bit about her journey in this. And just so you know, there's a woman from her younger 50s. I'm in my older 60s. So it's like two different kind of age ranges, but it's interesting what we are both experience alike and not alike. So I think that's kind of neat to see the perspectives of both our ages. So Lori, why don't you go ahead and go?
Sure. Thank you, Kim. So yeah, my story starts about 7 years ago when I stopped cycling and went into my OBGYN like I always did every single year. And I just asked the question, hey, am I in menopause? And, because my mom, my sister, all, they had gone through their own journey.
Mhm.
And right about the time I started my in-depth health and fitness journey is when I started to have some symptoms, the night sweats and the hot flashes. That's pretty much all I knew about menopause. And I was having that. And then all of a sudden they stopped. So I was like, cool, I'm just going to float through this. I'm not going to suffer like my mom and my aunt and my sister and, generations before. And so when I went to my OB and I asked that question, she said, well, when's the last time you had a period? And I said, I don't know, about a year ago. And she says, yep, you're in menopause. And that was it. That was the only discussion we had. And so, I was curious at that point because yes, I was excited about not cycling anymore and having to deal with all those things. And, I was at the very beginning of my in-depth health and fitness transformation, I would say, and didn't experience things until, well, probably the last year and a half. And I'm 54 now. And I kept asking questions. And my provider at that time was a physician's assistant, but she, in all honesty, was limited to her education as well as I'm limited to my education. So I just started to do some research on my own. And, we had talked a couple times about things. And recently, I had found someone online that was recommended from a doctor that I go to who's functional medicine based. And she was really well versed in women's health. So I started the journey with an online physician. And she was
Mm.
actually trained originally as a chiropractor, but she transitioned to women's health because she saw the need as well, because there wasn't much out there. And maybe, your listeners and your followers have that same issue that they just can't
Yeah.
seem to find an advocate or a partner in this journey. So that started the testing process for me. I did the saliva test. And when my results came back, I pretty much had nothing, which made sense because I hadn't been. And, my sleep had started to change a lot. I saw some physical changes that, I would say I'm 80-20 most of the time for my health and wellness, and I'm on track most days. I train every day. I lift weights. I do all the things that they say you're going to, you should be doing. And I'm still having these symptoms. What really kind of propelled me forward to go in even deeper is in December, I was coaching a fitness training class and I tripped and fell and broke my wrist. Never had broken a bone in my life other than like something very minor when I was young. So I went through that process and then I had bone scan done. And here I'm osteopenic. And I was like, how can that be? I do all the things that they tell you to do.
Right.
So that made me go and do a deeper dive into the fact that it's all related. It's all related to menopause for myself. And of course, it's going to look different in every woman, but that's kind of like my story. And when I reached out to my new physician, who is she's not a functional medicine doctor. She's in transition of practicing, but she's a direct care. So basically concierge.
Yeah.
She doesn't abide by all the rules that, the regular groups do. And so she's willing to be my partner in all of this. And so we started some different testing. And as of about 3 months ago, I am now on several different types of hormone replacement or hormone therapy, whatever you want to call it.
Yeah.
It's hormone therapy to me, whether you're in menopause or not. So
I think replacement is kind of the wrong word. It's kind of adding or replacing, like you said. It's you're not like I just feel like it's been termed, wrongly, I guess.
yeah. Yes.
So anyway, but yeah, I appreciate you sharing that. And now you're feeling better. Now you're
I am. So I was taking a topical estrogen. And again, there's what, 5 different types of estrogen.
yeah, there are.
I was
But
just one.
yeah, estradiol's the one.
Yes, estradiol. So I was taking a topical, and when I had my second set of testing, which is a different one, I did the Dutch test where it's the dried urine.
Mhm.
And it wasn't registering. And so she said, well, that doesn't seem to be working. Let's do something different, which I was so happy that I had that person in my life at the time that said, let's just try
Yeah.
something different instead of saying, oh, keep taking this, keep taking this. So I am now on an estradiol patch.
Hmm.
I also take DHEA, and we doubled that dose because it wasn't registering.
Mhm.
And I'm not doing anything with estrogen yet, but I'm sorry, with testosterone yet. And I'm also taking progesterone. So those are, that's the protocol I'm on right now. We're going to reassess in a month or so, and then see what's going on. But I am feeling better. My sleep is immensely.
That makes, and progesterone is really helpful with sleep. That's our calming hormone, and it's the one that helps regulate and balance estrogen and testosterone. So if you think of estrogen as like the big womanly hormone, and progesterone's like simmer down,
Yes. And the other thing that I noticed too is before I was having some issues with incontinence. Like the minute, the second you knew you had to go to the bathroom, it was too late. And that has subsided. It's not saying it's perfect, but it's gotten better.
Oh, good.
In my research, that was one of the things that they mentioned. So decrease in estrogen can create the incontinence issue. And I'm thinking, how many of us out there, ladies, when we sneeze or laugh too hard? And so it was just, and that has actually gotten better. So that's a huge plus for me. Yeah.
That's amazing. Yes. And I feel like knowing your own body too, like what you described, and we're all different. We all have our different issues. And I'll tell you my story very quickly. When I started transitioning in my 50s, I was spotting for a long time in my early, like 52, 53, and my primary doctor, she just put me on birth control pills. Which looking back now, I'm like, why? That was dumb. I've never been on them before. And, but I know my menopause consisted of migraines, 3 to 5 migraines a month, and brain fog, severe brain fog. And I was like kind of beside myself and dealing with that for like 9 years until my early 60s. I finally went to a gynecologist and found one I really like, and she got me on progesterone, take oral progesterone, and then it was oral estrogen at first too, but now we know better, like there can be a cause of breast cancer for oral estrogen. So even though I don't have any history of it, but so anyway, went to the patch, and here's the thing about that, and I loved it. It was great. But once you turn 65, it's like Medicare doesn't think you need it anymore, that you don't need hormones. And I know that's a crime.
Frustrating. Frustrating.
It's so frustrating. And I pulled up this article. So this new article came out from a study from the National Institute of Health came out, and it talked about that women using menopausal hormone therapy after age 65, it's proved to have significant risk reductions, 19% mortality, 16% less breast cancer, 13% less lung cancer, 12% lowers your colorectal cancer, congestive heart rate failure, lower, 5% lower. I mean, and dementia too, 2% lower dementia. I think those are real numbers that, you know, that how estrogen helps us. I mean, estrogen is, we were made to have estrogen. That's,
Right.
but obviously it gets lower as we get older. So I just,
Right.
go
And
ahead.
one of the things that I heard recently, and I apologize that I don't remember which doctor, because I listen to a lot of
I
different
know.
people, and I recommend everybody do that. Don't just take one person who did a little bit of, you know, their own study. Like, listen to everybody and kind of glean from it what you feel works best for you.
Right.
But one of the things that what they were saying when they were comparing sex hormones with men and women is that with men, you know, once they hit a certain period of time in their life, their testosterone pretty much stays the same and they're even. Whereas
Yeah.
women, that doesn't happen with estrogen. It just continues to plummet. And so we don't get that quote unquote respect in saying women need to have this looked at
Yes.
and supported in. I mean, all of
Mhm.
the testing that I have done for my own health, as far as the testosterone or all my hormones, has
Mhm.
been out of pocket, which is a crime. None of
Yeah.
my insurance
Oh,
would cover it.
yeah.
So, and you know, to me, that was worth the investment. I think of it as investment in my
Yeah.
health, future health.
Yeah.
So, you know, yeah, it was quite a bit of money, but now I know, and now I can do things, whether I'm going to supplement or just do other things like stress management, take, you
Mhm.
know, take that in consideration anymore, making
Yeah.
sure I am weight training, all the things that you can do that
Yes.
it's not, you know,
Yeah.
reliant on a prescription or anything like that. But sometimes that just isn't enough. And so what I encourage everybody that you know, I have consultations on a regular basis here in my facility, is that just start asking questions. It may not be right for you, but
Mhm.
start asking questions, start pushing, and start advocating for your own health. And I'm telling this to women that are not just in their 40s and 50s and 60s. I'm recommending that as just to start questions in
Yeah.
their 20s and 30s, because
Yep.
not that it's too late for us. However, that's when it starts. I didn't know that. I didn't know that it
Yeah.
actually started in our 30s.
Yep.
So,
Well,
you know,
yeah, you can be perimenopausal starting after 35, you
that's
know.
crazy. And
It
it
is crazy.
probably was and just didn't, you know, didn't think
Yeah.
anything.
Well, it could have been just like a slow descent
Yeah.
too, you know, that, and then all of a sudden you feel the changes. But it's true that I feel like the bottom half of the baby boomers, the second half of the baby boomers, and the millennials are,
Mhm.
women are speaking up. Like, we're not standing for, you know, like not being heard and not being treated, because a lot of women go to doctors and they say, oh, here, take these antidepressants, these will help
Yeah.
you. That's
Yeah.
kind of like the protocol. But a great book that Lori's read and I'm reading is called The New Menopause. I don't have it with me right now, by Dr. Mary Claire Haver. I will put it in the comments. It is such a good book about and I haven't finished it yet. Have you finished
I
it?
haven't either, but what I love about it, again, this is her experience as an
Mhm.
OBGYN who was
Yep.
experiencing menopause herself. So it's not just some guy telling women about menopause.
Right.
She was experiencing it. She was experiencing the same things we, the normal real women,
Mhm.
experience when we go to our doctors. And so she said, I've got to do more. But she gives
Yeah.
you practical things in that book, like, what should I ask my doctor? What test
Yeah.
should I try? And
Yeah.
that's what I really love about the book. There's things that you can take right from it and use. And it's
Yeah.
not, you know, it's not all about studies, but they're in there too. And I just feel like it's a really great resource
Yeah.
that will never go out of style in that respect.
Yeah, and you can follow her on Facebook too.
Oh yeah.
Facebook, she's on Instagram, she's on TikTok. She gives so much great information. And I just
Mhm.
wanted to spell, if you've still in the dark ages where you've heard hormone replacement therapy causes cancer or breast cancer, or increases your risk, the study was flawed. That was
Mhm.
done back in the early 2000s, and they've proven it over and over again, yet that has not gotten the notoriety or the fame like the initial study got.
Well, no, it wouldn't, because it's women's health who it doesn't get studied as much as men's health.
Right.
And when we get empowered with those things, we change the way that climate is, big pharma,
Yeah.
those types of things. We change that climate by being knowledgeable and educated about it.
Right.
So yes, I don't go visit my doctor as often as I would have if I hadn't been educated about what I know now.
Yeah.
And the other part of that is, oh Jesus, just my brain fog just kicked in. Hold on, I need a drink.
I know.
I just
Well,
lost my thought. There's so many things that we can talk about
right.
it. It just
There is.
amazing.
And again, it's individual for each person, like what you need or whatever your symptoms are. But finding a doctor, and I'm so blessed. I found a doctor here in Cincinnati who like listened to me, and I was nervous about talking about it with her, and she's on board. She's in her mid-50s. She's like, honey, let's try this. Let's work on this, and so we're doing different things as well just to find what works. But women should
Yes.
not have to suffer. Women
Right.
should not
And everything that we're sharing about our journey, it may not work for you. I mean, it's
Yeah.
something that you really truly have to investigate.
Mhm.
The methods at which I am getting hormone therapy may not work over time, and I might have to try something different. It's kind of
Yeah.
like fitness. It's kind of like changing
Yeah.
your nutrition. Sometimes you have to change things up to see
Mhm.
what's really working, and then you still have to change it up again later. So just, there is hope. That's what we are here to
Yes.
give the dispel, is there is hope. Oh, I know what my thought was when you said about the
Okay.
cancer. It was, and I think Dr. Haver said this, that the risk of that, you have to look at the risk of everything else that you're going to encounter by not having estrogen versus that risk of cancer. And again,
Right.
I'm not downplaying cancer by any stretch.
Right.
With that flawed information, all the other things that can happen to us because we don't have estrogen,
Mhm.
that's the risk I'm not willing to take. And that's heart
Yeah.
disease, that's dementia,
Mhm.
that's so many other things. Yes, cancer is bad, we know that, but so are these other things.
Yeah.
These are, heart disease is prevalent in women, and it's because one of the
Mhm.
things that they found in these research is it's
Yeah.
because of this decrease in our hormones. So
Yeah.
get empowered. Hopefully this will
Yes.
give you some, just some oomph to go ask questions that you don't
Yeah.
have to suffer.
Yeah, I agree. I think that's the thing. And being curious again about your own health,
Mhm.
like being what if I, what can I do if I'm not feeling good or not, I'm in misery or whatever, joint aches, inflammation. I mean, all the things. It's like we don't have to live with that. So we want
Look,
to
belly fat and all the things that we all say, I just can't seem to get rid of this belly fat. Where did it come from? I'm there. I'm back there. I've controlled that for a long time, and then all of a sudden it's there again, and I'm going, and it's not like, it's just different.
Yeah.
And I don't know why. So that's why I started, asking more questions.
Yeah.
So yeah.
Good. Well, thank you, Lori, for joining me today. I
You're
really
welcome. Thanks for
appreciate it.
inviting me.
And I know we could talk longer about this, but
Yeah.
if anybody has questions, feel free. You can reach out to either one of us, send us a message on Facebook or whatever. If you don't want to drop in the comments, I understand. So, but we're always open to talk about things. We live our life. We're trying to be examples and inspire others to live healthy and a long health span. So,
And show you what's possible.
exactly, that's right. What's possible? Yeah.
Awesome.
So, thank you very much, and I'll
Well
see
done.
you next week.
All right. Thanks,
Bye bye.
Kim.